Now let's take a quick look at the top worst hit states in India currently of Omicron. We're looking at Maharashtra now, that stands at 108. Delhi with 79 cases reported of Omicron. Gujarat reports 43 cases. Telangana reports 41. Kerala reports 38. Total Omicron cases tally now amounts to 422 in India. It is spreading at a fast pace, but so far the severity of this variant has been underplayed. In fact, doctors across been saying that there's not been a severe case of Omicron as yet. But nonetheless, we know that the COVID-19 infection itself is so uncertain. You never know what comes in the days. Not the time to let our guard down. Now, as the COVID cases see an uptick across the country, several states have tightened the noose to mitigate the spread of this virus during the festive season. Maharashtra government has issued new guidelines amid the Omicron surge. The state government has announced night curfew. Gathering of over 5 people in public places across the state is prohibited from 9 p.m. to 6 a.m. 50% capacity for gyms, spa, hotel, theatres and cinema halls has also been announced. Night curfew also returns in Uttar Pradesh between 11 p.m. to 5 a.m. The cap on the number of people attending events like marriages has also been limited to 200. COVID curbs has been extended until the 31st of December in the national capital. Ban now to continue on social and cultural gatherings. No New Year parties in Delhi this year. Karnataka has also issued new norms. In fact, night curfew has been announced in Karnataka for 10 days now, starting December 28th. So, mass public gatherings, celebrations have all been banned. Meanwhile, Haryana, Madhya Pradesh, Gujarat have also imposed night curfew. Tamil Nadu has made 7-day quarantine mandatory for foreign passengers and an RT-PCR test on the 8th day. Over 422 cases of the Omicron variant has been reported across 17 states in India, and 130 people have recovered from the infection, according to the Health Ministry.
A very, very welcome announcement. We thank Honorable Prime Minister for announcing this. Honorable CM had already told that we should be in the forefront, because already in regular vaccination in the first 4 months, Tamil Nadu showed maximum vaccine hesitancy. Similarly, we have identified 33.2 lakh students 15 to 18 years who have to be vaccinated. All those who are very active in public life have taken. They are seeking booster dose. So this announcement is also very useful for them, because they are desperate to take that additional dose.
The COVID situation is serious in Mumbai and Maharashtra. Mumbai recorded more than 700 cases. Maharashtra recorded more than 1,400 cases. And this is the reason why various restrictions have been imposed in Mumbai and Maharashtra as such. The BMC, that is the Brihan Mumbai Municipal Corporation, has said that there will be no parties, functions, social gatherings whatsoever. Health experts maintain that the cases might rise in January and February as well. And it is very essential for the people to realize their collective responsibility and abide by COVID-appropriate behavior. With camera person Mahesh More, this is Pankaj Upadhyay in Mumbai, reporting for India Today.
Now, we're looking at a late night announcement in the form of a Christmas gift coming in from the Prime Minister himself. In the address to the nation, Prime Minister Modi announced a series of moves to boost India's fight against the Omicron super mutant variant. In fact, here's all that you need to know as per what the Prime Minister has said himself.
Mega boost to fight against Omicron, with super mutant cases continuously peaking. Prime Minister Modi says enough is enough.
2022
Prime Minister announces boosters and vaccines for kids in Christmas address to the nation. Frontline workers to get booster shots from 10th of January. Comorbids above 60 to be jabbed in first phase of booster drive.
8 वर्ष से ऊपर की आयु के कोमॉर्बिडिटी वाले नागरिकों को उनके डॉक्टर की सलाह पर वैक्सीन की प्रिकॉशन डोज का विकल्प उनके लिए उपलब्ध होगा। ये भी 10 जनवरी से प्रारंभ होगा।
Prime Minister's booster rollout silences the long-standing demand for booster shots to combat the super mutant variant.
Giving booster doses to people who are vulnerable, because again, I think it's very well thought out that it's only the elderly who really are at risk in terms of the Omicron virus. And I think giving them an extra shot is always going to help.
Prime Minister also announced vaccination for kids between 15 and 18 years of age from Jan 3rd.
15 साल से 18 साल की आयु के बीच के जो बच्चे हैं, अब उनके लिए देश में वैक्सीनेशन प्रारंभ होगा। 2022 में 3 जनवरी को सोमवार के दिन से इसकी शुरुआत की जाएगी।
This announcement comes moments after DCGI approved emergency use of Covaxin for children, a 2-dose jab.
The best Christmas present we could expect, because we have been actually concerned about the children being unprotected. And the fact that this data that was presented or approved by the scientific committee some weeks ago was with DCGI, who's taken its time to really study the data and put it through the rigors of scientific evaluation. And now that it has been approved for emergency use, which is the normal way of doing it, like it happened for the adults also, it's a big relief.
India will also roll out nasal and DNA vaccines soon.
हमारे देश में जल्दी ही नेजल वैक्सीन और दुनिया की पहली डीएनए वैक्सीन भी शुरू होगी।
From increased number of beds to ample supply of oxygen, the country is on a war footing to tackle the surge.
भारत ने अपनी स्थिति परिस्थिति के अनुसार भारत के वैज्ञानिकों के सुझाव पर ही अपने निर्णय लिए हैं। भारत के वैज्ञानिक भी इस पर पूरी बारीकी से नजर रखे हुए हैं, इस पर काम कर रहे हैं।
The new year will begin with a bang, with the Prime Minister declaring an all-out war against the Omicron surge.
Who will get which booster? Will the double co-vaccinated have to take Covaxin, or whether Covaxin takers will go for Covishield? How much amount of dose will the precautionary dose be? And whether it will be free for those above the age of 60 with comorbidities? These are some of the questions that will require clarity before the big rollout begins in January 2022. Milan Sharma for India Today.
Now, even as the Prime Minister has announced the booster shot for frontline healthcare workers above the age of 60 as well, there are several questions that are now looming large that need to be answered. Which vaccine will be given as the booster? Will it be a Covishield, a double waxed? Will they get a Covaxin? Will the Covaxin double wax get a Covishield? Can basically we mix and match the vaccine? Those are the questions, of course, that need to be answered. Will booster dose be same as the first 2 doses, or can you give another dose even if you've got another vaccine in the past? Now, here are also frequently asked questions for children now that vaccines have come for kids as well. The question is, where are the vaccines for kids? How soon will it come to be rolled out? In fact, are kids more susceptible to the Omicron threat? Kids Covaxin nod delayed? That's the question. In fact, the nod has already come in, but when is the rollout going to happen remains to be seen. Of course, should India not roll out vaccine for kids? That's another question. While as much as the Prime Minister himself has said that vaccine for kids is a must, there are still several questions, considering a lot of apprehension from doctors about whether or not to vaccinate kids. Let me quickly cut across to doctors' reactions on the same. Across the country, doctors have hailed the move of the Prime Minister, asking for vaccination for kids and booster doses. This is what they said.
Vaccinating the children now is also very, very relevant at this point in time, when we are seeing rising number of cases in the youngsters as well. Although it's considered to be a mild illness in the children, but let's not forget there is a small percentage who do develop neurological complications and also develop the multi-organ inflammatory syndrome, which could sometimes be having devastating complications in children. Extending the COVID vaccine coverage to the frontline workers, to the elders, those with comorbidities, and to the youngsters is a very welcome move. I think the entire medical fraternity was looking forward to this news for some time now. And I'd like to embrace this as a New Year's gift from the Honorable Prime Minister.
What is your sense in terms of the gap that one needs to keep between the last dose taken of COVID vaccine, whether Covaxin or Covishield, and then going ahead for the booster? I'm guessing in this particular case, it will just be an extension of the existing vaccines that we've taken.
Yeah, so the entire science behind the boosters is that initially the Delta, and then now, of course, the Omicron has decreased the immunity, what we call as vaccine escape. And the reason is the particular positioning and the type of substitutions, mutations which have taken place in the Omicron have actually made those sites where the antibodies act redundant for the action. So the vaccines, what we produce as response antibodies, don't work as well against the virus. Now, what we are looking at internationally is there is a series of more than 80 or 90 international publications which have shown that the immunity post-vaccination, that means post the second dose, decreases between the 5th and the 7th month. And then the people become more vulnerable. So the breakthrough infection rate is slightly higher after that. There are 2 or 3 recent studies. One is from Rockefeller University, in which the vaccines have shown to increase the neutralizing antibodies 30 to 200 times more. There is also a recent study of Lancet, which has been done on 44 million patients in Scotland and Brazil, which has shown that the risk increases if you don't give the third dose. Also, an 8-platform comparison in Lancet, which has shown the vaccine efficacy to be diminishing, including the AstraZeneca. So the basis of this is thus, and the third dose is required. Any time between the 5th and the 7th month after your second dose, the Prime Minister, sir, has already mentioned that in early part of January coming year, we will start the third shot. What he's used very beautifully is a precautionary dose, and it's to actually give a message to the Indian community that your first 2 doses have worked. This is more a precaution to allay the fears that the first 2 vaccines didn't work. They have worked, and they have worked very well.
I want to get your sense on vaccination amongst kids. This has been an ongoing topic ever since adults started getting vaccinated. And every second parent you encounter is always questioning when my child is going to get vaccinated. Should I or should I not vaccinate children? Finally, with this announcement that has come in, what is your take?
Absolutely. It's a very, very welcoming step and a very relieving step as well for parents, for kids, especially, for the ones who were going out right now. It was the 15 and to the 18 years age group, which was actually, going out for their board exams, for their various kind of practicals, their schools and all. So they were the group which was actually exposed to the virus right now. And therefore, every parent was worried, as to how they are going to proceed further, and especially because this is a carrier time for them as well. So the concerns were even more concerning these kids especially. So I think it is a very, very welcome step that we are going to start vaccination for these kids. And if you look at US, UK and most of the other countries, they have already started vaccinating the kids. And in fact, they are giving booster doses now. So it's very appropriate time. Till now, we were more concerned with giving vaccines to the adult population and covering as much as we can. But now since Omicron, is kind of heading towards us, and the numbers have started increasing in India as well. So we have to be prepared. And that is what I think the government has decided, that the children from age
Are we, Dr. Maheshwari, late in the day as far as the race to vaccinate kids is concerned? Because there are countries around the world who have already finished vaccinating their children. We've not even begun. We've just made the announcement.
I don't think we are too late because, see, every country has different situations right now. One, we are a very huge country and our population is very large. In terms of what we are talking about, US and UK, they are like 1/8, 1/5 of our population. The other thing is that we already had gone through the Delta surge, and a lot of infection and sub-infections had happened in children. They were, kind of exposed. There was a lot of natural immunity, and that was suggested by the sero surveys that we did across the country, which was very suggestive that children also have got exposed to the virus and they have some natural immunity in themselves. And secondly, understand that US and UK were dealing with the surge now. So they were dealing with Delta surge, and then Omicron also topped on that. So they are seeing the double and the twin surges that they are seeing right now. Whereas India had already finished up with Delta.